Everyone can do their part to slow the spread of COVID-19. Do work and school from home. If you're in a critical infrastructure industry like healthcare or public safety, keep your normal work schedule and follow CDC guidance. Avoid social gatherings of 10 or more people. Practice good hygiene. Use drive-through, pickup, or food and prescription delivery options. Avoid non-essential travel, shopping trips, and social visits. Don't visit nursing homes, group homes, or long-term care facilities unless you provide critical help. Follow the directions of your state, county, and city authorities. Together, we can stop the spread of COVID-19. Learn more at cdc.gov/COVID-19 and coronavirus.gov.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
Magandang hapon po sa inyong lahat. Narito po tayo muli sa ating Beat COVID-19 Virtual Presser upang ihatid sa inyo ang mga updates sa mga inisyatiba at pakikipagtulungan ng kagawaran sa iba't ibang ahensya ng pamahalaan at sa pribadong sektor sa pagsugpo ng COVID-19.
It-100 ang dagdag sa tala ng mga gumaling sa COVID-19 sa Pilipinas. Sa tala ng Department of Health as of 4 p.m., 101 ang mga bagong gumaling kaya aabot ito sa 2,561 total recoveries. 214 ang naidagdag sa mga bagong kaso para sa kabuuang 12,305 COVID cases. 11 ang dagdag sa mga nasawi kaya nasa 817 na ang pumanaw dahil sa sakit.
Umaabot na nga sa higit na 70,000 ang kumpirmadong kaso ng Coronavirus Disease 2019 sa buong mundo.
Is our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level.
Korea has more than half of all cases outside China. However, the cases in the Republic of Korea appear to be coming mostly from suspected cases from the 5 known clusters rather than the community. It indicates that surveillance measures are working and Korea's epidemic can still be contained. Korea's situation also underlines that this is a unique virus with unique features. This virus is not influenza.
Local or community transmission na hindi na nila matukoy kung saan nanggaling. Pero malamang yan, may nanggaling sa Wuhan City kasi batay naman sa mga ulat sa atin, ang pinakamalaking bilang ng mga COVID infection ay galing sa Wuhan and sa Hubei province.
The Philippine government, meanwhile, unveils its COVID-19 economic recovery plan. On the table, cutting corporate income taxes across the board by July 2020. Bruce Rodriguez has more.
Kakaasa po kayo na pinag-aaralan ng kagawaran ang lahat ng posibleng solusyon para mawakasan na natin ang pandemyang ito.
Coronaviruses are group of viruses belonging to the family of Coronaviridae, which infect both animals and humans. Human coronaviruses can cause mild disease, similar to a common cold, while others cause more severe disease, such as MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. A new coronavirus that previously has not identified in human emerged in Wuhan, China in December 2019. Signs and symptoms include respiratory symptoms and include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and sometimes death. Standard recommendation to prevent the spread of COVID-19 include frequent cleaning of hand using alcohol-based hand rub or soap and water, covering the nose and mouth with a flex elbow or disposable tissue when coughing and sneezing, and avoiding close contact with anyone that has fever and cough. The World Health Organization is working closely with global experts, governments, and partners to rapidly expand the scientific knowledge on this new virus and to provide timely advice on measures to protect people's health and prevent the spread of this outbreak. As of now, there are 5,160,686 positive cases worldwide. There are 1,951,459 recoveries, and there are 333,000 dead. And every single day, it increasing the number of positive cases of COVID-19. And the United States has the highest positive cases worldwide. They have 1,608,586 50,084 positive cases and 95,087 dead and 380,195 recoveries. The second country as the biggest positive cases is Russia, as 317,554 positive cases, and the country that all we know this virus came from is now on the 13th highest positive cases worldwide, as 82,971 positive cases, 708,255 recoveries, and 4,634 dead. And our country is on the top 43 highest positive cases worldwide, that has 13,434 positive cases, and there are 3,000 recoveries and 846 dead. And we, the Filipino, fighting to this pandemic as one. We helping each other by giving some food, money, facilities, and service. And it's not easy for every country that have this pandemic, because they giving all their effort, money, and soul just to protect each people living to their country. And each of us have responsibilities to stop this pandemic. Each of us has an important role to stop this, like regularly clean your hand with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Keep alcohol-based and hand sanitizers out of children's reach. Teach them how to apply the sanitizer and monitor its use. Apply a coin-sized amount on your hand. There is no need to use a large amount of product. Avoid touching your eyes, mouth, and nose immediately after using an alcohol-based hand sanitizer, as it can cause irritation. Hand sanitizers recommended to protect against COVID-19 are alcohol-based and therefore can be flammable. Do not use before handling fire or cooking. Maintain at least 1 meter or 3 feet distance between yourself and others. Why? When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth which may contain virus. Avoid going to crowded places. Why? Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19. And it's more difficult to maintain physical distance of 1 meter or 3 feet. Avoid touch your eyes, nose, and mouth. Why? Hand touch many surface and can pick up viruses. Once contaminated, hand can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and infect you. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth or nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately and wash your hands. Why? Droplet spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Stay home and self-isolate. Even with minor symptoms such as cough, headache, mild fever, and until you recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. Why? Avoiding contact with others will protect them from possible COVID-19 and other viruses. If you have fever, cough, and difficulty breathing, seek medical attention. But call by telephone in advance if possible and follow the directions of your local health authority. Why? National and local authorities will have the most up-to-date information on the situations in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent the spread of viruses and other infections. Keep up to date on the latest information from trusted sources such as World Health Organization or your local and national health authorities. Why? Local and national authorities are best placed to advise on what people in your place should be doing to protect themselves. Everyone should wear a cloth face cover when they have to go out in public. For example, to the grocery store or to pick up other necessities. Cloth face coverings should not be placed on young children under age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes table, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hand with a hand sanitizer that contains at least 60% alcohol. Like what I said, we all have a role in our community to stop this pandemic. And we all know that no problems that our God gave us that we don't survive. We just need to be one and trust Him all along. This will stop soon if we will do the rules and safety protocols that the World Health Organization, Department of Health, national government, or local government unit said. We heal as one.